And welcome everybody. And quite a lot of people seem to be coming in now. There's an awful lot happening at the moment. I don't really need to tell you that. It's a busy time, and some of you I'm getting quite a number of comments about fees, fees not being raised sufficiently and lack of response from local authorities. We are interested to know confidentially what fees are being offered. We've seen a huge range across England of fees fees rising from no percentage to something like over 10%, and quite wide varieties between, say, domiciliary care, specialist care, mental health, etc. So it will be interesting to know what's going on with you. So if you just drop me a line confidentially, that would be good. We've added a couple of things to the website around hybrid working, and we're also changing the calendar on the website so that we can put a wider range of events on there that are of interest to people, and be able to go directly through to those. Those of you who were at the last meeting with CQC, CQC wouldn't let us have the slides after the meeting, but they did give us some links, and the recording of the meeting and the Skills for Care presentation, they are on the website, so you can access all those there. And Dudley, over to you.
Yeah, welcome everyone, and taking your time out to join us today. I know it's been a very busy month, and it seems almost as if the floodgates have opened and people outside of our sector thinking about the pandemic, but those inside still have to deal with the day-to-day testing, PPE and so forth. So in this strange crossover, it's seeing how we all manage to cope, and that's not just managers, but obviously staff. It's very intriguing. I've been lucky enough to have visited about 4 or 5 care homes recently, and what I found was they were very happy to be able to receive someone from outside and come in and speak to them. And a lot of them had a lot to say, and they mentioned a lot to do about their well-being, their mental health and their resilience. But the actual fact is that they know that it's not over and they still have to come again and really be themselves. So what I found a lot is that as staff and managers and everyone in the sector, it's really applauding you for what you've done. I know it doesn't seem like much, but just really celebrate those who work in the workplace around you. Try and be more creative to help, because we have a responsibility to help those who are working for us, because it's a sector which is struggling and has a lot of shortages of staff. And so we have to do things to actually try and aim to get them to stay in there and continue to really think about things. And we now know the weather's a bit better, so maybe it'll give us a chance for managers to be more creative, to support staff, to help them, discounts and so forth. So do look out, do look at anything that's collaborations. I'm really at the moment trying to push forward really celebrations for sort of the workforce, and obviously the public image for social care, because social care always gets to seem to be left behind. But I think it's a chance for us to show that as a sector, we are professional, we are important. And I think the more we do showcase that, it does go a long way. But it does require voices from all of you as a group. And when I do speak to, and Peter does, the likes of CQC and large organizations, they really want to know, there's NHS colleagues at the table, but we really do need some from social care. So please do try and show up or respond, or at least come to meetings which are important, and let yourself be heard, because without you, this wouldn't exist. So I know it's a bit of a rant and I'm going on, but there is so much things going on, and I will share some of the things I'm doing as well. I'll be speaking at the Excel Care Show in London that's taking place as well next month. And it's just more to do around inclusion, but also around bringing the workforce together and letting it be noticed as well. So as we do some of this good work, continue to join us. I know there's a lot of virtual fatigue, but where you can, spare some time and support your staff. And that would be one of my sort of messages for today. But we've got a great set of speakers. We're doing a lot around overseas workforce, which is a really important topic. And we've got some great presenters in here today who are actually advisors with Skills for Care, and also as well advisors to the Home Office. So do get your information and your pads together to sort of take that information going forward. We've also got someone who's actually gone through the system and tell you of the experience. And we also have Skills for Care with Laura, who will be sharing us all the great things that Skills for Care are doing and all the availabilities there are on the actual website. Apart from that, enjoy the session. Thank you, everyone.
Right. Thanks, Dudley. Just picking up on a couple of things that Dudley's mentioned, there is a petition on the government website for better financial support for social care staff that are isolating because of COVID. Please do sign that. And also, we're trying to find out nationally the amount of time that social care providers are actually paying for sick leave. And so if you could let me know, we can put this into a survey. Again, it's anonymized, but it's useful to know. And Care England are coordinating that one. And there is a very important survey which the Care Providers Alliance are doing. Again, it's on the website, and it's about fees and local authorities. So if you don't contribute, we're not going to find out what the situation is. So please, I know you're short for time, but do please contribute to these things, because without contributions, we don't have a voice as social care. Having finished that, Laura, would you like to kick off? And I'll put your slides up.
Great. Hopefully everyone can hear me. I'm having a few tech issues this morning. So I'm going to talk to you today about workforce development funding. And I know I've spoken about this at previous meetings, but we've recently heard it's going to be made available again during this financial year. So I just wanted to give a reminder about what it is and what you can actually claim for, as we want as many organisations as possible to benefit from it and to be able to claim money towards the cost of development of their staff and their managers. I'm seeing some messages in the chat saying, can't hear me.
I mean, I can hear you, Laura. I think you're slightly a bit muffled, but maybe if you speak up, so we can hear you, just a bit muffled. So we'll see how far it gets. If anyone else has an issue, let us know, and then maybe we can try something else.
Also, as well as WDF, so some of you here today will know that one of the criteria for being able to claim the Workforce Development Fund is having an adult social care workforce data set account. So I'm going to talk a bit about what that is, WDS for short, and what the benefits of having an account are, in addition to being able to claim the workforce development funding. We'll go on to the next slide, please, Peter. So the Workforce Development Fund, hopefully most of you will be aware of this already, but it's a pot of money that adult social care organisations can access to put towards the cost of staff development. And what you can actually claim money for, all the accredited adult social care qualifications, like diplomas in health and social care, you can claim for apprenticeships. We also fund smaller qualifications, which are available in a range of topics like dementia care, stroke care, learning disabilities. There's a whole range. You can also claim funding back for some of the leadership programmes that have been created by Skills for Care. There's programmes aimed at registered managers. There's programmes aimed at people who want to go into management roles. There's also some CPD modules for registered managers, which cover topics like performance management. And there's also an end-of-life care awareness programme for frontline staff. There's a module for care certificate assessors that you can claim for. There's some mental health first aid courses, and also some modules around preparing for CQC inspections. So a lot that you can actually claim money back for. And if you go to the Workforce Development Fund section of our website, I put the link at the bottom there. You can see the full list of what's funded. And as I say, there's just so much that hopefully you'll be able to find something that meets the needs of your own organisation. How to apply for this funding? So we route the money through funding partnerships. There's one for South West London, which is led by Clarendon Care, a home care agency based in Norbiton. Some of you may know David Vincent, who's the manager there. He has come along to these meetings before to talk about the funding. So if you get in touch with David, his email address is at the bottom of the slide there. He can talk you through how to join the partnership. It's just a case of filling in a short form, and he can talk you through the claims process as well. If you're based in North West London or another part of London, you can still join the South West London partnership, despite the name, they're open to employers in other parts of the area. You can also claim directly from Skills for Care, and do look at the WDF section of the website, as that talks you through how you can actually do that. So we're hoping the fund is going to open for claims around June or July. But if you are completing qualifications or learning programs now, you can still claim for these, as it's usually anything completed since January, you can actually claim money back for. So do look into that pot of money. We want to make sure as many employers as possible can benefit from it. And the next slide, please, Peter. So moving on to the Adult Social Care Workforce Dataset, or AskWDS. Can I just check before I start talking about this, how many of you already have an AskWDS account? Could you type yes into the chat or raise your hands? Oh, a few yeses coming through, that's great. So a quick overview of what this is. It's a data collection service that's commissioned and funded by the Department of Health and Social Care, and it's a leading source of intelligence for the adult social care sector. So without this data that we collect by the AskWDS, it would be really difficult for the government and other bodies to make decisions about policy, to make decisions about funding, as they wouldn't know how many people work in the sector, they wouldn't know what jobs they're working in, how much they're being paid, and lots of other information as well about the workforce. So Skills for Care has been tasked with collecting this data on behalf of the Department of Health and Social Care. And how we do this, we ask organisations such as yourselves and also local authorities to set up accounts and input information about your service and about the people who work for you. And we estimate that currently about 20,000 organisations in England are using AskWDS. They set up accounts and they're providing us with their information. Next slide, please, Peter. So there's lots of benefits to having an AskWDS account. It's a kind of thank you for you providing us with your information. You can access the Workforce Development Fund, as I've just spoken about. But something else you can access is our rapid induction and essential training. You just flick onto the next slide briefly, please, Peter. So some more free learning that you can access for you and your staff. And the first thing that's available is the Rapid Induction Programme, obviously aimed at new staff. And this covers the knowledge elements of the care certificate. So if you're paying for induction, do look into this. We can also fund training for existing staff. So your refresher training, your mandatory training. And this is available in 8 different topics, including infection prevention and control. There's a programme on safeguarding as well, and 6 others. So people can do all 8. They perhaps can pick 1 or 2, where they urgently need a refresher. And if you take on volunteers, there's a half-day programme you can access for them, which is an introduction to adult social care. So these courses are all being delivered by Skills for Care endorsed learning providers. So you can be confident they'll be of a high quality. And they're all being delivered virtually at the moment, whether that's via Zoom or perhaps video call or webinar. And the funding for these actually ends at the end of May. So if you'd like to access any of these, do click on the link at the bottom of the slide. You'll get the list of all the learning providers that are delivering these courses. You just need to get in touch with one of them just to have a chat about what they can offer and to book your staff on. And we're not sure if this will continue post-May. So do have a look now and sign up if you do have any staff who need induction, who need refresher training. A really good opportunity. If you flick back to the previous slide, Peter. So other benefits of having an AskWDS account, because you'll be inputting information about your staff training and qualifications, it's just a really good way of managing all the different records. You can print off training and qualification records from your account, which is really good evidence to use in CQC inspections, just to show that your staff training is up to date. There's also a benchmarking function. I don't know if anybody's had to look at that already. I think this is really helpful, as it allows you to benchmark your own workplace against other providers in your local area. And that's the metrics like pay, turnover, staff qualifications. So just to give you an example, if you're a manager of a care home in Croydon, you can see what the average hourly pay for care workers for all care homes in the borough is. So you can see if you're paying more than the average or less than the average. And if you're paying less, that could potentially be a factor in why it's difficult for you to retain your staff, because they can go to a care home, perhaps up the road, or be paying slightly more. You can also see if your staff team's more qualified than the average, if your turnover is higher or lower. Just really useful information. And if you do pay more than the average, you could perhaps say this in your job adverts. And if your turnover is lower than the average, you can highlight that to the CQC in your inspections. So really useful data. Also, you can access the Skills for Care bundle offer, and that gives you discounts for some of our seminars and e-learning programs and our membership of registered managers. You can also access discounts on courses and qualifications which are offered by our endorsed learning providers as well. But what I think is the real benefit of having an account and providing this information to Skills for Care is that whatever you provide can really help sector decision makers, as I've touched on, like the government. If they didn't have access to this data and this accurate picture of the care sector, it would be really difficult for them to identify where support's needed to plan and develop for the future. And we all know the sector is facing many challenges, and not just this year and previous years, and of course in future years. So our data really helps to highlight the challenges that the sector is facing and what's actually needed to address these challenges. It's just a way of making your voice heard. And fitting in with the theme of today, I wanted to give you a quick example of how our data is being used to influence policy. So the Migration Advisory Committee were undertaking a review into the impact that ending freedom of movement had actually had on the care sector. And we supplied data to inform this review. And as a result, they recommended that care workers be made eligible for the health and care worker visa and added to the shortage occupation list, which is something that's now happening. So just to show that your information can really make a difference to the sector. If you could flick 2 forward, Peter. Just made this presentation really confusing. Just to give you an idea of the type of data we're going to be asking from you, there's 2 types of records. So there's workplace records, and this is where we ask information about your organisation, and staff records, where we ask more information about your staff. And these are the data fields in the workplace record. So you can see we're asking information about the main type of service that you deliver, how many staff you have in total, how many vacancies you currently have. We ask about your starters and leavers. The next slide, please, Peter. And then the staff records. We ask that you complete a record for each member of your staff. And this is the information that we ask for. And you may wonder why we're asking some of these things. They may seem a little bit random, but just to give an example, we ask about someone's home postcode, as the data we collect about distance travel to work is actually really helpful when it comes to our recruitment planning, because we know from our data that people travel less than 3 kilometres to work in the care sector, which is just quite helpful when we're recommending to employers about their own recruitment practices to really focus on recruiting staff from your local area, so they're a lot more likely to stay with you. And I appreciate it can take a little bit of time to complete these staff records, but once the information's in there, it's just a case of updating it occasionally. And the next one, so just to say, if you don't already have an account, it's really easy to get started. Just go to the link at the top of the slide there. And it only takes about 5 minutes to set up an account. All you need are a few basic details about your organisation and the services that you provide. And it's a really simple process, but if you do come across any issues, we've got a support team which you can contact by phone or email just to answer any questions you may have. And if you want to recap about anything I've spoken about today, we've created a 5-minute video just at the bottom there, which tells you more about the benefits of having an account. It goes into a bit more detail about how we use the data, how it's anonymised, how it's secure. And you will get these slides afterwards, so if you get a chance, do have a look. I think the last slide is just my contact details. And contact details of Selina, who covers North West London. So any questions about the funding or about RWDS, just get in touch with one of us or the support service and we can help. Are there any questions about any of that?
Just a quick point, Laura. Thank you very much. I think people may have heard of WDS, but I think when people hear the word funding or actually access to funding, it probably pricks up our ears. So this has been going on for a while and people always put it at the bottom of the list. And before you know it, it's gone. And Laura does say, when it's available to you, a lot of us in social care don't take up a lot of the funding and grants. And me and Peter get people coming back to us, oh, can you get this? Can you get that? So we think it's important to actually share this information, which is really, Skills for Care are doing a lot behind the scenes. And obviously they bring forward data. A lot of this data is used when being presented at governmental levels as well to showcase what's going on in social care. So it's really important to actually add to this. And then we'll be speaking to Laura, probably trying to do some master classes around the actual application and actually joining with your workplace. So do look out for that going forward. I know we've got a hand up from Gloria in the audience. So Gloria, please ask away. Gloria, I'm not sure if your hand was meant to be up.
Yes, good morning. Hello?
Hello, Gloria, go ahead.
Can you hear? Okay, good morning. I just wanted to ask a question about this most recent presentation. I had an account, but I think there was this information to update and something like that before a due date, which unfortunately I missed. Do I have to register as a new provider again, or can that be restored?
Gloria, I'll put the contact details for our support service in the chat, as they'll be able to help you with your account if you can't access it, and they'll be able to advise about whether that can be kind of reset or if you need to open a new one. I'll do that now.
Okay, that's fine. Thank you.
if I could just make a couple of points here. Workforce Development Fund is incredibly useful, and there's a wide range of training providers that, you know, seek Skills for Care approved training providers that use WDF and will help you with any claims or evidence. It seems like we're all plagued with cats this morning, and it isn't that difficult. And also, from the point of view of data, social care is dismal about the supply of data. And every time we talk to anybody such as the DH about, can we have more money for social care, they go, where's the data? Every time we mention data to social care providers, they go, oh, we don't want to do that. Well, I have to say, you're going to be forced to do it at some point. And so you might as well take the view of putting a bit of effort into it, getting your ASC done. And I would guess that you're all doing the tracker still at the moment. That is likely to continue. Don't moan to me. But there will be little or no funding for it. And that's been raised at a pretty high level as well. So when you get requests for data, please do provide it, because every other sector of trade has this. And when they go to the government for information or for money, they can back their claim up with data. And unfortunately, at the moment, we can't. Rant over.
Thanks for that, Peter. I think it also, as I said, goes beyond. Laura touched on a topic of, you know, comparing what the pay rates are in your area. We know the cost of care is important. These are just some of the small things and benefits of doing this. There are training providers which they provide, which they have got on their, they've got on sort of accredited sort of providers who you can also go to as well, who also provide this training. So there is many more things there behind it all, rather than just filling out a set of forms. It has various benefits. So thank you very much, Laura, for all of that. Yeah. Peter, I think this is, we're a care agency. Is it beneficial for them too, Laura? It's a question.
Yeah, any care organisation, your data will be really helpful for us, just to give an accurate picture of the sector to governments. And also as a care agency, you can access our funding as well. So yeah, beneficial on both counts. Fantastic.
So for those, it's not just care homes, it's care agencies, dom care, all across the board, or access to the actual WDS funding. So I think it would be great for those to actually to benefit. And it's a truly thing that Skills for Care are trying to do and help everyone. So all it requires is your time and help.
And there's loads of advice around Skills for Care. The people at Skills for Care are very helpful about getting your ASC done. And it isn't that complicated, and you don't have to do it all in one hit. So you can do it bit by bit. But as I say, please do sign up. And we will be having a special event around WDF in September, which will include a couple of training providers such as Social Works. And I see John and his cat are here. And they've always been very helpful supporting providers.
Yeah, so do look out for that. We will signpost you and give you enough notice so where you'll be able to come in, or send someone from your team to actually come in to do that as well.
Okay. Anything else on WDF or Skills for Care in general? Okay, silence. In that case, at your request, we have Laurence with us from Fragomen to talk about visa applications, etc. As you know, Fragomen came before, and we also posted a long update of Q&A from them as well. So they have got an updated presentation. And so Laurence, over to you, sir.
Thanks, Peter. I'll just share my screen now. So just give me one moment. Okay, and if we start my slideshow. Okay, can everybody see that and hear me okay?
Fantastic.
Okay, brilliant. Thanks, Dudley. Good morning, everyone, and thank you for letting us come and speak to you again this morning. just to give you a little bit of background, you can see there are two people listed there, but just myself this morning. Unfortunately, my colleague Siobhan, who was present at the last event, has been called to an urgent meeting this morning, so isn't able to attend. So her apologies. Just a little bit about myself. So I'm a UK immigration lawyer. I've been practicing UK immigration for coming up 13 years now. I've practiced all different aspects of it, from refugee and human rights through to more business-focused immigration. Throughout that 13 years, I've seen all the different ways in which the immigration system has changed, and in many ways actually stayed the same, or the same themes come up time and again. So what I'm going to talk to you about this morning is just to try and give you as good a picture as I can of how your sector might be able to use the immigration system. Before I move on, I think it was very interesting to hear from Laura then about the way the data was used from your sector, and it's actually an example of how at the moment, although the government gives out lots of mixed messages, if you're presenting the right data to them, you can get positive changes in your sector. And one of those I will be talking about as well, but Laura mentioned, which was about the opening up of care assistants and care workers to the shortage occupation list, meaning that work visas are now a possibility for those individuals. But anyway, I'm getting ahead of myself a little bit there. To start with, I'm going to talk to you about what we mean when we talk about right to work in the UK, and who has the right to work in the UK automatically, who is likely to have it without needing your assistance, and then looking at the scenarios where you have a candidate that you want to hire, and that they don't have any other visa options. So what can you do to assist? So we're going to then look at how you can get a sponsor license to then be able to issue sponsorship, which can be used by that candidate to then apply for a visa. I'm going to look in some detail at the different considerations for your sector, because there are different occupation codes and how that's relevant for your sector. Give you an overview of what a visa application process looks like, and a brief case study there. And then I'm going to finish up by talking to you about if you are a licensed sponsor for visas, what that means for you in terms of what compliance duties do you have. Obviously, I know you guys operating in a heavily regulated sector already, and perhaps the last thing anybody wants is additional regulatory concerns or duties and responsibilities. But it is really important that you do understand the significance of those duties when you hold a sponsor license. So I will try and answer questions on the chat as much as I can, but I will, if necessary, I can follow up after the session with some answers if I don't manage to get through them all. All right, so if I just move us on there. So right to work, what do we mean by right to work? We in the UK, all organisations, regardless of whether you have a sponsor licence or not, need to be carrying out right to work checks on any new staff members. So to help you with that, we've put a summary here of who has the right to work already in the UK. And the first group of people, or perhaps unsurprisingly, is people who have British passports. So if you're a UK national, you're automatically deemed to have the right to work. You may actually have individuals who are British citizens, British nationals, who don't have a passport, so they can prove their right to work in other ways, but that's beyond the scope of what I can talk to you guys about today, because it gets into quite a lot of detail. But just to be aware, if you've got someone who's a UK national, they have the right to work in the UK. You don't have to worry about sponsorship for them. Second group of people that you can see listed on the slide is Irish nationals, which is something that not necessarily that well known, but anybody who is from the Republic of Ireland, they are also deemed to have the right to work in the UK by virtue of a long-standing agreement that the UK and the Republic of Ireland have. So Irish nationals and UK nationals automatically have the right to work. So that's nice and simple. After that, things start to get a little bit more complicated, and you'll see from the slide, you know, we've got quite a lengthy explanation for the second point here. So the second group of individuals you might come across who have a right to work already, and they're going to be people from the EU who were in the UK effectively before Brexit took effect. You can see I've mentioned there, I've said EU now, but actually in the slide it says EEA in Switzerland. That's just to explain to everybody, the EEA is all of the countries in the EU, so the 27 members of the EU, plus a couple of additional countries, so Norway, Iceland, Liechtenstein, and then you've also got Switzerland as well. So we group them all together because they all have the same rights. So even though Switzerland isn't in the EU, we put them together here. So that group of individuals, anybody in the UK before the 1st of January 2021, a lifetime ago now it seems, if they were here before that date, those individuals are going to have, in all likelihood, be able to have the right to work because they're going to have applied under something called the EU settlement scheme. Big government scheme that was set up to protect the rights of EU nationals who were already in the UK before Brexit took effect. So that's obviously going to be a very large number of individuals, and those individuals should be able to demonstrate they have to have made an application under the scheme, so they will know if they've made an application, and they'll be able to show to you, look, I made an application under the scheme, I have the right to work. And then you don't need to be worrying about visas for those individuals. Moving on from that group of individuals, you then have we then have a group of individuals who may have a right to work because of some other connection to the UK. So if you've got individuals who perhaps have got who have a British spouse or who have been here a long time and actually got what's called permanent residence or indefinite leave to remain, those individuals might have a right to work. They have a visa, but that visa will carry a right to work with it, and that'll be obvious from what's written on the visa itself. It tells you if somebody can work or not. Sometimes the terms can be a little bit confusing. So students are a really good example of this. Students have got really quite complicated work permissions, but they can work for certain amounts of time. But generally speaking, you'll find individuals who have a visa already may already have the right to work. Obviously, if you're not sure, you can get in contact with Fragomen, and we can make an assessment for you on that. I've seen a question about delays. Yes, I'm definitely going to be coming on to that. And then we've got a question on an EU national who's been here but hasn't applied. That is a complicated issue. Or the scheme is, you can make a late application to the settlement scheme, but that needs to be handled very, very carefully. So an individual who's in that scenario should get in touch with an immigration lawyer, either Fragomen or somebody else, to get assistance on that, because that's going to be a complex application. I won't go further into that because, as I say, it is to stress that scenario is very complicated, but that's something that we can assist with separately, but they don't yet have the right to work if they haven't been under the scheme. So as I say, you've got individuals in the UK who've got a visa and they're going to potentially have the right to work. The last group then is people might come to you who are already in the UK and they already have a work visa, which is called a skilled worker, a health and care visa, or a tier 2 visa, but they're already working for somebody else. If they come to you with that, they won't be able to work with you until they've got a new permission with sponsorship from you. So that's the main groups that we're looking at here. And then obviously you've got individuals who aren't in the UK who haven't got a visa at all, and those individuals will also require a work visa from you. Okay, I'm just going to move us on now to look at what it means to to have a sponsor license. So as I say, if you want to be hiring people from outside of the UK, Ireland, or who don't fit one of those categories above that I just talked about on the last slide, you're going to need a sponsor license from the Home Office. So what does that mean? The sponsorship is a licensing agreement you have with the Home Office. If you have a license, you're then given the ability to issue a certificate of sponsorship, or sponsorship in short, to candidates who need a work visa. That candidate will then use that sponsorship to apply for a work visa. Now, in your sector, they're going to be applying for a health and care visa. It's technically falls within a skilled worker visa, but it has a special name because of the sector that it's in. But you'll be sponsoring for a skilled worker health and care visa if you are successful in getting one of these licenses. So in the Home Office's with the Home Office, you have, if the Home Office grants you the ability to sponsor people, in exchange, you have some serious responsibilities. So once you have a license, then you can sponsor. So I can see somebody's asked a question, don't have the right to work, but want to sponsor. What you need is a sponsor license, and then you'll need to sponsor. So I'll talk you through that process as we go through these slides. I'm just going to pause there just to talk a little bit about processing times, because I saw that come up as an issue. The Home Office is under a great deal of pressure right now. I must say, I don't work for the Home Office. I'm not their biggest fan. I've got a lot of issues with the way they operate. But right now, they are under a great deal of pressure, and they're having to divert a great deal of resources to assisting with the schemes that have been set up for Ukrainian nationals. And we are seeing that is having a knock-on across all different aspects of the immigration system. I think I saw someone mention a 6-month delay. Now that's beyond what I would expect to be because of resources being diverted. So if you are experiencing that sort of a delay, that's something that you may want to, you may want to approach us separately about that, because we may be able to liaise with the Home Office and get a better picture for you on that one. But it is causing delays in the system. I'll say that for sure now. And there is another aspect of delay that I'll come on to in a little while. But yeah, for sure at the moment, resources are very stretched within the Home Office, and that is having a knock-on effect. Okay, so how do you become a sponsor? Now, some of you, I think, have already been through this process, and some of you are perhaps considering going through this process. So how do you become a sponsor? So to become a visa sponsor, your company needs to meet these requirements. So you need to be a genuine trading company in the UK. So what that means is the Home Office will want you to provide evidence that you are set up. So that takes the form generally of documentary evidence. Typically that will be a corporate bank account or business bank account. It will be registration for VAT or other HMRC documents, employer's liability insurance certificate, and then other, anything in relation to your registration with the relevant authorities as well. It is, the documents you need to provide depend on the circumstances of your company, and that's something that Fragomen can advise on. And in a moment, I'll tell you how we can assist generally, but that's something that Fragomen can assist you with to kind of determine what documents are needed. So you've got to prove that you're a genuine company in the UK. The next issue is there has to be a genuine vacancy for the role you wish to issue sponsorship for. That's not generally going to be an issue because you guys are only applying for a license because you have vacancies that you need to fill. But just to bear in mind, this is an area the Home Office takes quite seriously. So they don't want people applying for licenses to then get sponsorship and then that person just disappears and goes and works and does something else. So you need to, there needs to be a vacancy that you're trying to fill. And you'll need to keep some records of how you identified the candidate that you hired. You don't necessarily have to advertise in a certain way or anything like that, but you need to be able to explain how you found the candidate to prove that it's a genuine vacancy. The next point you need to meet is that you need to have, and this is something the Home Office will assess, you need to have strong HR and immigration compliance processes in place to maintain the license. So, you know, I appreciate the sector is full of different sizes of organizations. Not everyone has in-house HR. You may actually, you know, you may have a third-party HR provider, which is absolutely fine. But you need to be able to show that you have the HR infrastructure in place. And what we mean by that is, you know, do you know who's working for you, where they're working, when they're not working, when they, you know, when they're changing work locations, you know, when there's changes to their salary, when there's changes to their job description. So you need to be able, you know, you need to have a framework in place that's going to be able to capture that information, because it's all going to be relevant to the immigration side of things. You also have to have some key personnel who are able to take responsibility for the sponsor license. I'm not going to talk in a great deal of detail here, but the main thing you need to have available is an individual who will be nominated as your authorizing officer. They need to be a senior member of staff who have overall responsibility for your immigration compliance. It can be typically that be somebody on the HR side or somebody at director level. And that individual does have some individual liabilities as well as the business level liabilities as well. It needs to be somebody who's based in the UK and somebody without any criminal records. So it is an important role, and it's something you'll need to establish, you know, when you're applying for a sponsor license. So those are the key points you need to be able to show to be able to get a license. Now, you do that. There are a couple of other points I've put on the slide here that I just wanted to cover off. Firstly, the fees. Now, there's no point in pretending the UK immigration system is expensive. The health and care visa that is available for your sector is actually the cheapest work visa that's available, but there are substantial fees that apply. So just to factor that in. So to start with, the fees that you're looking at to become a sponsor, so this is just to get the license, you've got two rates. If you're a small company, and that's, you know, I use that in a legal term, if you're a small company, you know, if Companies House consider you a small company, then you will pay £536 for your license. If you're not a small company, then you'll be paying £1,476 for your license. Now, that gets you a license that's valid for 4 years. And it's the initial outlay that you need to make. And there are additional costs that apply. I can just see somebody's raised a question about, we have a senior care worker license. Can we change this to the care worker? You don't need to, actually, Patricia. It should, your license will be valid. If you have a license to apply to issue sponsorship for senior care workers, it will now be valid to apply for care workers as well, without you needing to make any change. If you've got any specific queries on that, just drop me a line after the session, and I can help you out with that. Okay, perfect. So processing times. Now, obviously, we've seen one example this morning of somebody who's been waiting substantially longer than this. This is just the average from what we see at Fragomen, which is, you know, between 2 to 4 months processing, and that's end to end. So that's you gathering the documents and then us submitting the documents to the Home Office. So, you know, bear that in mind. I can see your check. Okay, the check was sent back. That sounds like that application was deemed to be invalid potentially. Again, that's one that if you want to contact me afterwards, Margaret, perhaps we can talk about the situation you're facing there. Oh, this is a really good point, actually, before I move on. Is it a requirement that the vacancy has been advertised locally before seeking overseas staff? No, it's not a formal requirement that it has been advertised locally. That used to be the case. You had to advertise it locally in specific ways, and you had to send that evidence to the Home Office. You have, but not anymore. You just need to be able to keep a record of how you recruited somebody and how you deemed that they were the appropriate candidate. So no, you don't have to advertise in a specified way, but you can, it would make your application stronger for a license if you can also show to the Home Office, look, we have tried to recruit for this role and we had, say, 0 applicants, or we had no suitable applicants, but it's not officially a requirement. Okay, so I'm just going to move us on now to sort of talk a little bit more about how Fragomen can help you with your license side of things. So as you've just hopefully seen, it's a pretty complicated situation for applying for a license. I admire anyone who's able to do it without assistance. It's an impressive achievement, because as much as the Home Office like to try and make things user friendly, it's not their strongest suit. So how can Fragomen help? We are a sole focused law firm. We only do immigration law, and we practice immigration law around the world. So we don't just practice in the UK. We've got offices in more than 50 countries. So if you've got colleagues or acquaintances in the sector, then who are going to Canada or Australia, for example, then Fragomen can assist with that. But on a separate, but that's a separate conversation. But in a sense, we are here to help you get your license and maintain your license. So one thing, and we are our licensing team is made up of experts, including those who have previously worked for the Home Office, so have a close insight in how to make sure your license it goes through successfully. So my colleagues in the licensing team will do an initial assessment and due diligence on your business. So making sure that your HR policies and compliance policies are suitable, making sure that you've demonstrated the requirement for the license, making sure that you're sending the right documents. We can offer different versions of our service. If you want, we can apply, we can prepare the application end to end and submit it for you to the Home Office. That's our most comprehensive service, but we also have a service available where we can send you instead a guidance document, and like, this is what you need to fill out on the application form for the license. These are the documents you'll require. So, we've got different options to tailor to different budgets. Then further on from that, we can also give you guys training on the UK's immigration system, and indeed the compliance requirements that you need to meet. And then once you've got your license and you want to continue to use it, we can continue to support you through that. So Fragomen can actually take over managing the license for you. We can issue your sponsorships if you need us to. We can make the necessary notifications that you need to do on the license. So I was mentioning earlier, if somebody changes where they work, for example, or there's a change to their job title or job description, that's information that needs to be notified to the Home Office. So Fragomen can assist you by doing that on your behalf. So I'll move on now just to break down into how the actual visa application works. So we've got you to the point where you've got your sponsor license. What do you need to do now to get in for the individual to get their work visa so they can come into the UK or move to your company and start working in the role you want them to do? Yes, care staff can be recruited from any country in the world. That's correct. Yes. There is no restriction on who you can sponsor by nationality. I've just got another question in relation to compliance, so I'll just answer that before we move on to the point on the slide. So reporting staff absence. So okay. So you've got somebody who's absent, unpaid for 2 weeks. yeah, that might be potentially one you'd need to report. I'd want to look into the circumstances a bit more there, but yes, that is, and if you were to report it, it would be on the SMS. So I'd contact me separately about that one, because that's a tricky situation where somebody's unpaid and whether they're absent without you knowing, or getting approval. That's one that's got to be carefully handled. But yes, that's typically the sort of reporting duty you have, is people who are, where people are absent without permission. Okay, perfect. So. Can you sponsor recruit from? So the Home Office don't from WHO red and amber lists. The Home Office doesn't distinguish on those. I've got one on English language, so that is going to neatly segue me back into my slide. So I'm just going to move on to that now, if that's all right. So. You may have heard the government talk a lot about the points-based system. It's the big thing that they've been they've introduced this points-based system for work visas that allows people to allows the UK to control immigration. So these are when they're talking about the points, these are the points. I sigh a bit there, because it's not really a points-based system. It's just a bunch of requirements you have to meet. There's not many options. So anyway, I'll just walk you through those now. So you've got the first thing that an individual needs is to have sponsorship from a company that has a sponsor license. So once you guys have got a sponsor license, if you're offering sponsorship, then that individual's automatically going to get 20 points. The next consideration is, what job are they going to be doing for you? What job are you sponsoring them for? And this is actually where the changes that the Laura was mentioned become relevant. So on the next slide, I'm going to tell you which jobs, which are the main jobs that would fall into this. But just for now, you need to understand that the job needs to be a recognised occupation code. And as long as it is, then it's going to be 20 points as well. The last requirement that an individual has to meet is that they have to prove that they can meet the English language requirement. They have you've got now it's quite complicated, is English language requirement. There are different ways to meet it. If the individual is from a majority English speaking country, so perhaps from the Caribbean, from North America, from Australia, New Zealand, if the individual is from a majority English speaking country, then they will automatically score 10 points for English language. They don't need to pass an English test. So that's the first way. The second way is if they have a qualification, a degree level qualification that was taught in English. If that degree was taught in English, then that can usually be used to meet the language requirement for the visa. You may need to get some additional certification about that degree from a different government body called ECCTIS. It used to be called NARIC. You might have heard of NARIC before, but that's an organisation, a government, sort of semi-government organisation that basically certifies qualifications as being of a required standard. So degree that was taught in English with a required certification, that's another way to get you 10 points. And then the last way to get you 10 points for English language is to pass an English language test. And I can see one of the questions in the chat is specifically about one of the English tests. So the Home Office has a fixed list of English tests that they will accept. They are generally known as generally tests for UKVI is how they are distinguished from other English language tests. The question that I've got here, somebody who has an IELTS, has passed an IELTS, which is one of the, they're one of the English language providers, and they've scored that in the past. Do they still need to do IELTS UKVI? Yes, they probably do need to do the IELTS for UKVI, because although they've passed a good English language test there and they've scored 4.5, if it's not the right version of that test, i.e. a version that is for UKVI for the Home Office, then they won't accept it for the visa and the visa will be rejected. So English language testing is quite complicated and can be easily mistaken. The candidates need to be directed to take the correct test. Again, we can assist you with that if that's something that you're having trouble with, but you can find a list on gov.uk of what are the approved English language tests. So that's English language, so either from a majority English speaking country, have a degree taught in English, or they pass a specified English language test. Okay, so they must score all 50 points to move on to the second part, which is to look at the salary that they're going to be paid. So that then takes us on to what's the minimum salary requirement, and I'll break that down in some details. But for now, you can for care workers or senior care workers or nurses, they're going to fall into job is on a shortage occupation, so 20 points there. So we'll move then on to look at what that means. So overall, the individual has to score 70 points, but frankly, you're not going to think about that very often. You're just going to think, right, are they doing a skilled job? Have they passed English? And what's their salary level? A really good question. If you've got from somebody about just on English test before I move on. If the student is studying in the UK, they are to be sponsored. Do they still need an English language test? They might be exempt actually. If they've got a UK-based qualification, it's possible that they'll be exempt, or they might be exempt in another way as well. But yeah, that's a good question. They may be exempt. Okay, perfect. Right. So on this slide, I've set out the main roles that that will be eligible for sponsorship under the system. So this was the biggest change here has come from the first one that I've listed there. So care workers. Now that's listed as what's called SOC 6145. That means standardized occupation code. But SOC, so that each occupation in the UK is broken down into a different code. It goes across every type of job you can imagine. So when you're looking to sponsor somebody, what you need to do is their job description will fall into what you need it to fall into one of these occupation codes, generally speaking. The big change that we've seen for your sector is adding of care workers, so 6145 now being eligible for sponsorship. Prior to the 15th of February this year, that wasn't possible. Care workers were not deemed to have a high enough skill level. Were not deemed to have a high enough skill level, unfortunately. So they weren't eligible for sponsorship prior to February this year, but they are now eligible for sponsorship. And that's actually thanks to the fantastic work by Skills for Care in getting that data, showing the impact that that Brexit and the pandemic had on the sector and how severe staff shortages were. So right now, if you want to hire a care worker who needs sponsorship, you're able to do that. So that care workers occupation code covers care assistants, care workers, home care assistants, support workers in nursing homes, and you're eligible. They're now eligible for a skilled worker health and care visa. Now the minimum salary they need to be paid is £20,480 per year. Sorry. So it's a significant minimum salary, and that isn't likely to change for a while. But that's what it's set at. I can see. Sorry, just before I move, I can see somebody says student working for 20 hours and applied. Student work conditions. Yes, if they're outside, if they're in vacation times, they can potentially work full time. Especially if after they finish their studies, but it needs to be carefully handled. Sorry, anyway, I think I've covered the other questions in there. Another good question there on minimum salary. Yeah, so somebody's pointed out that the minimum salary is also an hourly. There's an hourly minimum as well. You're absolutely right. So it's 20,480 is your baseline minimum. You also have to when you look at the number of hours they're worked and what their hourly rate works out to be, it needs to be a minimum of £10.10 per hour as well. So if the number of hours they're contracted to work each week is actually is so high, is high enough to then mean that the average they're earning per hour drops below £10.10, then yeah, they're not going to qualify for salary. So you'll need to increase their salary so that they are meeting both 20,480 and an hourly minimum of £10.10. So the other occupation codes that are on here are obviously senior care workers. They continue to be eligible for sponsorship. They need to be paid the same amount, 20,480, and an hourly minimum of £10.10. And then you've also got nursing as well. Now, nurses and nursing assistants, their minimum salaries actually needs to be in line with the NHS banding rates rather than the 20,480. So that will depend on which country you're in, England, Scotland, Northern Ireland, or Wales. So those are the key occupation codes that you'll be looking at. So if you're looking to sponsor somebody and their job description needs to fall within one of those, if it falls within one of those and they meet the minimum salary requirement, 20,480 or £10 and £10.10 an hour, then you're good to move on to sponsorship and for the individual to then apply for their visa. Okay, so we've got thanks, Eleanor. I'll make sure I drop my contact details in here. Just put my email address in here should anyone want to get in touch after the session. Right. What happens? So once you've got an individual who's then sponsored, they then have to look to apply for their visa. Now, the way that they apply for their visa is slightly different. It is slightly different depending on if they're in the UK or outside of the UK. At the moment, we say assume a processing time of between 6 and 8 weeks for the visa. It may take a little bit longer if they're outside the UK, just because that's where we're seeing the biggest impact on processing times. You can pay for visas to be done quicker in the UK at the moment. Outside the UK, you can't do that. It's been suspended. We've got the other requirements that you'll need to meet. The other requirements the individual needs to do. They'll need to get overseas criminal record certificates. That's different from a UK DBS check. They need to prove that they haven't got any criminal record overseas to be able to apply for their visa. And so that can take a little bit of time. So it may add some processing time. And again, if they need to do an English language test, they'll need to that can extend the process a little bit as well. If they're outside the UK, you need to apply for a defined certificate of sponsorship, and then that is something that usually takes 1 to 2 days to come back by the Home Office. But we have noticed that is actually taking substantially longer for care providers. We've seen examples of that, of the Home Office requesting further information, it taking several weeks. That shouldn't normally be the case, but that is what we're seeing at the moment. Now, we can't say for sure when that's going to get better, but it may be that it's just because of this is a new concession that's been introduced. But normally it takes 1 to 2 days for the defined certificate of sponsorship to be approved. Once the individual's got their certificate of sponsorship, they then can apply. Now, if they're from outside the EU, they need to do an online application and book an appointment to go to a visa centre to give their biometric information, so the fingerprints, and have the photo taken. If they are from the EU, then they can use an app on their phone instead, which means they don't have to go to an application centre. Then lastly, depending on where they're living, they may need a TB test certificate. So some countries are with high prevalence of tuberculosis. Individuals coming from those countries to the UK need to have a test to prove that they do not have TB, and that's a requirement for the visa application. If the individual's in the UK, it's a little bit easier. the individual, you don't have to apply for a defined certificate. You can use one of your own certificates of sponsorship that's on your license, and you can request more of those if they run out. You can just issue that without needing to get further Home Office approval. The individual then, again, if they're from outside of the EU, need to do an online application and book an appointment at a centre in the UK. And then similarly, if they're from the EU, they can use an app instead. Permission under the skilled worker or health and care is normally granted for either 3 or 5 years. That's slightly different. It's slightly more expensive for a 5-year, but the maximum duration is 5 years. And then after 5 years, the individual is normally eligible to get indefinite leave to remain or permanent residence. Good question there, actually, I haven't got on the slide, which you can. Dependents are eligible, so that's spouses or unmarried partners if you've lived together for 2 years, and then children up to the age of 18. They can apply for dependents visas at the same time or a bit later than the candidate, and they'll be given the permission to stay in the UK for the same length of time. Good question. Can you do all of this after your? Yeah, you have to do all of this after you've got your license. So it's a 2-stage process. 1, you get your license, then you have to look at issuing sponsorship to individual employees. So like I say, it's a 2-stage process. You may have to specify in your license application who you want to sponsor, but that won't automatically lead them to being sponsored. They will have to be, you'll have to go through this sponsorship process as well, and then visa application process for the individual. And yeah, don't worry, I'll pop my contact details in there, name and telephone number, as well as my email address in a moment. So just moving us on to a case study, which obviously all of this information there's a lot of information to take in here. So I've tried to put this into a scenario for you. So we've got our chap here. We've got Ahmed, who's Algerian. And he has been in Algeria his whole life. He's got a level 3 diploma in adult social care, and he's been offered a job as a home care assistant in London, starting in July. His employer has a sponsor license, and he's going to be paid £20,500 per year. So what does that look like in terms of his visa application? So we've got Ahmed will score the following points, as we can see. So we can see his employer has a sponsor license, so that means he's getting his 20 points. Home care assistant is a skilled occupation, so he's getting 20 points for that. English language, he's got a level 3 diploma, which is below degree level, so it's even if it was taught in English, it's probably not going to be good enough. He's probably going to have to do an English test. And then his salary of 20,500, assuming his hourly rate doesn't drop below £10.10, is going to be scoring 20 points as well. So what does he need? So the main things he's going to need to do is to pass a Home Office approved English test. He's going to need a criminal records certificate from the Algerian authorities to show he has no criminal record in order to apply for the visa. And then he's also going to need a TB test certificate, because Algeria is one of those countries that's listed on the tuberculosis list. I've just got a couple of questions I'll answer now before I move on to talk about compliance. We've got, can organisations who have a licence to recruit care workers recruit for other providers as well? It's a really good question, that, Margaret. It's not to be vague, but it's complicated. Sponsorship is meant to be done by the organisation that decides what an individual is doing on a day-to-day basis. So that would normally be the organisation that was that was utilising the care worker. So recruiters, agencies wouldn't normally be the ones who could sponsor for that. And it is something that Home Office are quite quite hot on. They, you know, if they think that that's what's going on, an organisation is sponsoring and then sending out their staff to other organisations, there has to be a clear contractual arrangement, and it has to meet a number of requirements that are quite carefully worded to make it quite difficult. So, you know, do contact me about that if you want to have a a conversation about that. Because it is complicated, and it's one that the Home Office are on the lookout for potential problems within that. So generally speaking, no, but in some circumstances it might be able to. Let me see what else we've got on here before I move on. So how do you charges? We've got 6 different services for sponsor licensing. So I'll say, if you get in touch, I can send you a proposal document which shows you what our different service levels are, and you can decide which one suits you best. Students who want to switch to healthcare worker, how do you apply for them and their dependents? So an individual who has a student visa and wants to switch, it's pretty straightforward. You'll need to issue them sponsorship, and then they'll have to apply for a visa with them and their dependents. Let me see what else. Candidate has completed BSc nursing in English in a non-English. They will probably be okay. They'll need to get that degree certified by ECTIS. But as long as that degree is deemed to be acceptable by ECTIS, then yeah, they don't have to do an English test. Yeah, what is the total point requirement? So the points don't change. You're always going to need 70 points. It's just that the different occupation codes, other occupation codes can affect salary. So nursing's different salary from others. ECTIS, so I'll put it on here, ECCTS. They are a government organisation that, they're a government organisation that basically review qualifications to make sure they meet the same standard as in the UK. Okay, so I'm just going to move us on to compliance to make sure I get through all of my slides, and then hopefully answer some further questions if we've got time. So this is just a summary of your compliance obligations once you have a license. So you've got to make sure that you are doing you're doing right to work checks for everybody, not just people you sponsor, but everybody. That's their number one concern. And you've got to, I've put a link to the guidance there. So if you've got any questions specifically about right to work, we can handle them for sure. The Home Office expects you to tell them if there are any changes of circumstances for people who you've sponsored. So this is really important, because I know obviously if you've got individuals who are working at multiple sites, if somebody changes where they're working, then you have to let the Home Office know that there's been a change to where they're working. If they finish the job earlier than you expect, if they resign or they move to another, hand in their note, or they're made redundant, or they're dismissed, then you need to let the Home Office know about that. You also need to tell them when there's a change to job description, or if there's a change to job title. That's the sort of information you need to be telling the Home Office. Lastly, you also need to be able to track when somebody's right to work is going to expire, and make sure that you're helping them to apply for an extension if that's necessary, to make sure you don't end up with somebody who did have the right to work then ending up illegally working for you because it ran out. That takes me to the end of the slides. I've got a couple more questions in here. Can some people in the UK without a stay be sponsored? Yeah, that's again, if people have got who aren't necessarily in the UK with current permission, there are very limited circumstances they can be sponsored. It needs to be a very short period of time since their last permission expired. Otherwise, they're best off making a different type of application depending on their circumstances. It may be if they've been here a very long time, that there's an application to be made from within the UK. If they have only been here a short time and have run out of permission, then the best thing's probably going to be for them to leave the UK and apply from outside, maybe with your sponsorship. But people who have run out of immigration permission in the UK, it's really that's a really sensitive situation that needs to be handled carefully, and definitely one to get an immigration lawyer on for sure. So another question, if somebody's got a family here and place to live lined up and the relevant points, are they more likely to be accepted? Not really, actually. On the points-based system, it's as long as you meet the key requirements. So you have your sponsorship from an organisation that has a license, you're doing a skilled job, you meet the minimum salary, and you've got English language, that's all you need to meet. So having family here doesn't actually make an application stronger in that scenario. It's just a you know, that tends to be only that tends to only matter if somebody isn't going to be sponsored for a work visa, and then you're looking at their family circumstances. But no, you generally just need to meet the key requirements.
Anyone is happy. I'm Lawrence. I'm not sure if you're happy for anyone to ask any questions and raise their hand.
Yeah, absolutely. Sorry, Dudley. Yeah, I should have been clear. Yeah, absolutely.
That's okay.
Anybody
I'm
wants
not sure,
to...
because I know questions have come up, so I don't know if I know you answered some of the questions in the chat, but if anyone actually wants to ask a question, they can do.
Yes.
Lawrence will leave. I know we've got probably about 10 minutes or so left. Lawrence will leave his contact details. And I know there's so many questions that people want to ask. So if anyone does want to raise their hand and ask a question, they can do. Lawrence, in the meanwhile, will probably answer some of the questions that have come
I'll
in.
keep answering some on here as well. There's my contact details as well, guys. So you've got my direct dial as well as my email on there. Can a student who has a year to go on their studies, can they switch to a skilled worker visa? Yeah, that's probably going to be possible. That I would say, if they're looking at ending their studies sooner, yeah, that's possible. They'll still have to meet the English language requirement if they aren't going to pass a degree or pass their qualification, but generally speaking, they can switch into skilled worker even if they're partway through their studies. Can you get a different allocation for undefined cause? Yeah, so the way it works for your undefined, your defined, defined are only used for people who are outside the UK. If they're outside the UK, you have to jump through an additional hoop. You have to ask the Home Office for a single cause certificate of sponsorship, a defined certificate of sponsorship, just for that individual. For everyone else, so people already in the UK, we've got examples of students who are looking to sponsor, you use an undefined certificate of sponsorship. Now, each organisation, when you get a license, you have a fixed number of those undefined, and you can use them as you want to. When they run out, you have to ask the Home Office for more as a batch rather than an individual.
Thanks for that. I mean, I think there were a few questions that were sent to me, and there's one other clarification I wanted during the session as well, Lawrence.
Yeah, go for it.
Just to reference, there are a list of English-speaking countries. There is a list if you go to the government website.
There is, yeah. I can probably just dig that out for you now. If I stop sharing my screen, I can get that for you guys and just post it in the chat quickly. Yeah.
Because some people are unaware of actually different countries. I know you mentioned some parts of the world, so there is an actual list of. Yeah,
to be clear, there is a fixed list.
That's fine. So that's one of the things. I know you're probably digging it out. Why do you do that?
Yeah, absolutely. But go ahead.
Also, as well, what equivalent English would you say? I know that we've got IELTS and we've got levels 4.5, we've got 6. How does that look like if you were to transfer it to English? Is it GCSE level, A level?
Yeah, really good question, that, Dudley. Yeah, so it's about GCSE level. You're looking, so it's technically known as level B1, which equates to roughly GCSE. It's not a perfect conversion, but roughly GCSE level. So there has to be a reasonable level of competency in English. So, and it's across the 4 elements. So speaking, listening, reading, and writing. You need to be scoring a B1 across all of those. yeah, the link I've just posted there takes you to the English language requirement for this visa type, but you can see a little bit down there, you've got the full list. In fact, I can also just copy that into here as well, just for everyone. There you go.
Thanks for
So
that.
that's the full, that's the definitive list.
Okay.
There was a point that was made to me, which I think you've largely covered, but one of the operators who was planning to get a license, what that part of their plan was to bring in, say, 4 people, 2 for themselves and 2 to rent out or hire out, if you like, almost acting as an agency to offset their costs. Now, my understanding is that that's not a legitimate way of doing it.
Unfortunately not. Unfortunately not. And I just as a general comment on that, I think this is an early part of the process that the Home Office, this is the first time that the Home Office has really been interacting a lot with your sector. Their practices and the way that they set it up is not necessarily tailored to the way that all sectors operate. So I can appreciate that does cause difficulty where you've got sectors where agency staff are really common. It does make it a challenge. I do know that in other sectors as well where agency staff are more common, there is work being done to lobby the government to try and create some allowance for organisations to agencies to sponsor, or umbrella organisations to sponsor, so that there's a little bit more flexibility. It's not happened yet, and it may never happen, but there is work being done in the background to try and make that a little bit easier, just to reflect the fact that you've got different scenarios.
Yeah, fantastic. I'm not sure if Eleanor has come on, she wants to speak, or she happens to have unmuted. I'm not sure. Eleanor, did you want to ask a question?
No.
Okay, no problem. Okay, that's fine. There were 2 other questions I had very quickly. What's the maximum amount of people you can actually apply for coming over, which was one of the questions that some of the providers have asked. Is it 1, 2, 5, 10?
Good question. There's no maximum. The Home Office don't say you can only do this number. If they're overseas, then you're going to be applying for an individual defined cause for each of them. So all you need to do is just submit applications for each of them. The Home Office could turn around and say, well, you're quite a small organisation. Are you really is it realistic for you to be recruiting 50 people? But that's pretty uncommon, I'd say. In most cases, they'll just look at the individual application for a defined certificate of sponsorship and say, okay, does this meet our requirements or not? So yeah, no maximum you can apply for. You just have to, if they're outside the UK, you have to apply for one of these defined causes for them.
Only reason because some people have realised the length of time it takes, so they want to try and apply for as many as possible, because eventually by that time they will come into the organisation. That's what some of the providers are thinking. So that's one of the points.
No, really good question. Just on that, by the way, I would say if you do get a defined cause approved, or by the Home Office to use, it's only valid for 3 months. Okay. So just to bear that in mind.
Okay. I mean, someone's in the group has said that they have requested 10 CN license, but they were only given 5. So
yeah, that's probably for your individuals who are in the UK already. That's when you've applied for a batch number, and they will look at the individual. They will look at the numbers a bit more. They'll look at the numbers you're requesting. So for your undefined certificate of sponsorship, so the allocation that you have to hire people who are already in the UK, you apply for a batch number there. And if you apply for, like I say, if you apply for 50 and you've never issued any before, they won't necessarily grant you in full. What you have to do is justify the numbers that you're requiring. We can help with that.
I know we're almost running out of time. There's 2 quick questions. Just a point of clarification. I know someone mentioned about, can we apply to African countries? Yep. And I think you can do, but I think there is a point that some African countries, there is an issue about the workforce. Is it on the red list? And so there is.
Yeah, that's something that's I think that's an interesting point. So from some countries obviously have their own restrictions on effectively on exit. For example, the Philippines is a country where you have to effectively secure additional permission to come to the UK from the Overseas Labour Office, and similar requirements. yeah, some countries have that type of requirement. The Home Office doesn't specify that, though. The Home Office doesn't say no, you can't recruit from these countries. That's obviously those are separate ones that are being added, by other organisations or other countries saying, or other governments saying, no, these are additional steps you need to be able to move overseas. But no, Home Office doesn't specify anything about red list or anything like that.
Yeah, so it's not on this end. It will be from the country of where you're actually bringing a worker from or a carer from.
Yeah, exactly.
And the final question is about the dependents. Is there an amount of money that you have to have in your account to be able to bring a dependent over?
Really good question. Yes, unless the employer has said that they will cover sponsorship. Now, if you're saying you're going to cover maintenance, so that amount of money, you don't actually have to provide that amount of money to the individual. You just have to basically tick to confirm that you will cover it if it was necessary, and then that stops them having to show that they've got the money in their account. It just makes it much easier. So yeah, sponsors can cover that on behalf without you actually having to give the money to them. You just have to say that you would, in the event that they were going to be destitute, you would cover them. But yeah, you don't have to actually give them any money.
Because the dependents, if it's a spouse, can also work here as well. So
yeah, absolutely. Spouses have a really, it's quite generous to the UK comparative to other countries. Dependent spouses have the right to work in the UK. The only restrictions is they can't be professional sports people, and they can't be they can't do certain medical training.
Thank you. I think we've covered as many questions as possible. I think people have given you their number and taken your email address and so forth.
Yeah.
So and we're also going to be posting this video. Peter's going to put up some of the Q&As as best as possible where we can. So do go onto the Lcas website, and we also will have they can send us extra information if you want, and Laurence will try his best to answer, if not along with his firm as well.
Absolutely.
And Peter, is there anything else you'd like to add as well?
I mean, thank you. I think that's very useful, Laurence. There's an awful lot of information there, and clearly it's a confusing situation. I saw, I think it was yesterday, that the NHS are making a major recruiting drive, and so they're targeting the UK for that, so that people in the social care will move away, but they're also targeting importing people from various parts of the world. And that makes importing folk for social care very competitive. So the offer that you make to people has to be a good one.
Mm-hmm.
Thank you very much, Laurence, for that. And we're probably going to ask you to come back again, give us a couple of months. So.
Our pleasure, guys. It's our pleasure. Look, I know it's, it's challenging times at the moment, and getting the right advice early on can make all the difference to how successful your interaction with the immigration system is. So yeah, I can see some folks. Yeah, if you want to get in touch, by all means, just drop me a line either on give me a call or drop me an email, and I'll get in touch. But yes, I'm at that point. I am going to have to shoot, unfortunately. But it's my pleasure, guys. I will send you over I'll send you over the deck, Peter and Dudley, and you can circulate that.
Fantastic. Thank you very much. Thank you, one and all. And if there's no more from Dudley, I will close the meeting. And we'll
just very quickly,
the next meeting.
Just very quickly, Peter.
Jolloff.
So I'm just going to push. If anyone who's available today in Brixton, I've got a jollof rice event supporting and celebrating health and social care. It's a battle, and it's happening in Brixton. I've posted it in the chat. So if anyone is interested, they can come down today. It's from 5:30 till 7:30. There are prizes and awards up to £200 in vouchers, a dinner and so forth. So anyone who's free and wants to grab a piece of hot jollof or warm jollof food, you'll be fed and watered and celebrated. It's all free and for the fun of celebrating the workforce. So please do come down, enjoy, and you can get in touch with me or Peter if you want any further information on that. But thanks everyone for joining the event. Thanks to Skills for Care and Laurence and Fragomen as well. And obviously, please do. And if you do want to as well, we have a WhatsApp group as well, so you can actually see and find out more information. I'll post the number very quickly in the chat. And everyone take care. And I think, Peter, the next meeting, what's the date of the next meeting, Peter?
May the 25th.
Okay. Thank you very much, everyone.
Cheers.
Okay, great. Thanks, and good luck for the next few weeks. We'll be in touch. Cheers now. Thanks, Laura. Bye. Bye.